With me all morning is Dr. Iris Gorfinkel. She's a family physician in Toronto. You've probably seen her on our network because she's been so helpful to other programs, and we wanted to harness her expertise on ours this morning. So good morning, Dr. Gorfinkel. It's a pleasure to meet you.
The honor and pleasure is mine.
And you're going to be with us all morning answering our viewer questions, so we will bring those to you just as soon as they start coming into us. But in the interim, I have questions for you. Here we are on a Friday morning, Dr. Gorfinkel. We're coming to the end of the week where so much has changed. Canada now operating under the Quarantine Act, more than 4,000 cases in the country. What is your read as we speak on where we are in this pandemic?
Right now, we're climbing the curve, and I just hope that that curve is, in fact, a flattened curve. It's unbelievable the difference that the social distancing measures make. In fact, there was a recent paper that just came out now examining it, and it shows that we're flattening the curve as much as 90% right now. So you can imagine, you could just take the numbers we're seeing now and multiply it by about 10 if we weren't doing these social distancing measures.
But we don't know yet if they're working. When will we know that? If we have flattened
We
the
do
curve?
know that they're working. I actually don't agree with that statement.
Okay.
We do know that they're working, and that the numbers we would see would not just be greater, they would be far greater. And that's what this study out of Singapore demonstrated, that without the measures, that the curve would be a lot steeper, that the numbers we would be seeing would probably be about tenfold.
I thought we were talking about lagging by 2 or 3 weeks, so we weren't seeing the full effect of whether or not our measures have flattened things significantly. But as you say, we're climbing the curve, and you hope it's not the steepest one. What, in your mind now, is the worst case scenario?
Oh, you know what? You're asking a family doctor, and I actually do not know exactly where this is going to go. I think a lot will depend on what we do. How long are we going to stay in lockdown? Clearly, there's huge economic costs to doing what we're doing, but I don't see that we have any choice right now. The numbers would be not just greater, they would be far greater if we weren't doing what we are. What will happen after, when so-called phase 2, when everyone goes back to work, when the kids are going back to school, when we're no longer doing the social distancing dance? I really don't know. I think that the numbers they're certainly going to go up, but to what degree? And what degree seasonality will play a role in it, it's really hard to say.
Let me get your read, either what you're experiencing or what you're hearing within your medical community. John and Karen were just reporting on shortages of gloves and of masks and of ventilators, this essential medical equipment. And I think it might be hard for Canadians even to appreciate or even imagine that this would be the reality in this healthcare system of which we are so proud. What are you hearing, and how would you help us understand why this is happening?
It's pretty terrifying when you consider that for me as a family doctor, I ran out of masks about a month ago. They were on back order 2 weeks prior to that. So we're talking 6 weeks for a family doctor not to have masks. And the normal operation in my office is if you've got a cold, we'll slap a mask on you right when you come in, because we know that prevents you from infecting other people. Now imagine healthcare facilities, hospitals. So I would make an appeal to those of you who have actually stockpiled masks to donate them to hospitals, because that's where they're needed most. And as the reporter said, 50% are normally made in China. And right now, the world is running to these masks. We just don't have enough of them to go around. And it's important to protect those healthcare workers as well as the other patients.
Well, we're going to need them, and in huge numbers based on what we're anticipating. I'm just curious, so what are you doing in your own practice if you ran out of masks a month ago?
I'm practicing with a physical distance. I practice now from home. We're bringing in virtual visits. I'm doing telephone calls. It's just as busy as ever. But I'm missing a crucial factor, which is seeing my patients and touching my patients, doing a physical exam. So without that, I worry that the quality of the medicine is not the same. But that said, it's the best we can do in the time we're living in.
I have questions just pouring in. So let me jump right away to Vivian's question for you, Dr. Gorfinkel, who has elderly parents, 86 and 90. And Vivian is wondering whether she should ask the personal care worker and the cleaning lady to stop going to her parents' home.
It's a very difficult situation. Here you're balancing out the benefits that they would get from that personal support worker against what's going to happen if they do not have that personal support worker. This is an individual decision, not an edict. So you have to take those into consideration. That's not a question that I could actually answer for you. But I would say that if those those personal support workers and the cleaning lady have any symptoms at all, they have to stay away from your parents. Certainly if they have sniffles, even what they consider as minor symptoms, it needs to be emphasized to them that they do need to stay away in that situation.
We've talked in the recent days generally and in our society and our conversations about mental health and how to deal with the mental health aspects of this pandemic and the many changes in our life. Actually, we have a mental health practitioner, a registered psychologist named Todd, who's wondering what worries or fears are most prominent in the minds of your colleagues in family and emergency medicine right now.
There's a tremendous amount of fear. I would say the largest amount of fear is for patients themselves. What are we going to do if our systems are overwhelmed? What are we going to do if we're faced with difficult choices of whom to bring into hospital, whom we should test? I mean, this is already happening, the testing part. And who should get that ventilator? Who should get that ICU bed? These are really difficult decisions. And then there's fears around, what if I personally become infected? And what if I carry that infection to my loved ones, to my family? So yes, there's a lot of fear.
Well, we just met a cardiovascular technologist who actually put her son with her parents because she was so concerned about his not contracting this, should she, in the hospital setting. Can I just pick up on what you said, though, the fear about what if we reach a situation where the hospitals are overwhelmed and where doctors are having to make those most unimaginable ethical decisions to decide which life to save? I mean, how likely do you think those worst case scenarios are, Dr. Gorfinkel?
So here I'm actually going to push back a little bit because it's not doctors in isolation who make those decisions.
Okay.
Those difficult decisions are going to be made involving the family, involving the person themselves, involving what the outlook is. So if this person is to be assigned a ventilator, if it should come to that, what is their prognosis? Are they going to live better or longer for having been on that ventilator for 10 days? Because that's how long on average it's going to take to improve. So these are not straightforward questions. These are not decisions made by a single individual, but rather in the context of their so-called comorbidities, what else they're sick with, and also the family, and also the resources, what's happening. There's a lot of things that play into it. It's often a team decision as well.
So, okay, that is a very important thing to talk about. Yes, and there are ethics committees in hospitals that make these difficult decisions around treatment already, and it would be certainly called into play, I would imagine. But just even the specter of that, having to make those decisions in terms of rationing, I guess, medical care, and as you said, you know, the overwhelming of the system. Is it looking increasingly likely to you as you watch what's happening, or just give us your sense on, you know, your level of fear, where we are?
Yeah, great question. I mean, I think personally that we're climbing the curve right now. You know, that we're still seeing the numbers going up. I'm very hopeful that come the warm weather, that will prove to be a turnaround. Consider that the official end, there was such a date actually, who would have known, of influenza season last year was May 25th. Now, this very well may not follow that trajectory. However, it is an influenza-like virus. We are hoping that the warm weather will bring lower numbers. But for now, we're still climbing that slope upward in terms of numbers. And where we're going to go with this, it remains to be seen.
Question about, this is great advice in general, but this is from a healthcare worker to you, someone who's been looking after patients, in fact. Any suggestions to minimize the risk of spread to the family when this worker comes home at the end of the day? This is from George, and thank you for it, George. We've heard some really interesting stories about doctors who literally take off their greens and they go right into the washing machine every day when they come home. Can you give us some suggestions along that line that maybe not just healthcare workers, but anyone could implement, Dr. Gorfinkel?
It's very difficult because we're entering the realm of things that we really don't know. For example, how long does the virus live on skin? So there's some data about how long it's living on various surfaces. And on solid surfaces, up to 3 days, they say. However, we don't know the minimal infective dose of virus that it would take for a person to actually get sick if they are exposed. So there's a lot of questions here. We know that the virus dies off exponentially on surfaces. So let's put that aside. In a high-risk healthcare situation, taking a shower, changing your clothes makes sense when you come home. That's personally what I would do to try to protect family members. As far as wearing a mask constantly at home, no evidence to support that as yet.
We haven't had this question in a couple of days, so let's bring the latest information. Tanya from Chateauguay writes about being pregnant. And for pregnant women, is it still safe to deliver in the hospital, or would it be preferable to give birth at home at this time?
Well, so far, we don't believe that pregnant women are at specifically higher risk of having COVID-19. That said, we do not have data on the outcomes of hospital births versus home births in terms of the safety for COVID-19. I think the decision has to be made on an individual basis on the risks of the pregnancy going in and on what is set up at home.
Yeah, the risks of the pregnancy, that might be obviously a key consideration. Maybe there is some concern on Tanya's part about just being in the hospital environment when we know there are increasingly large numbers of coronavirus patients also there, Dr. Gorfinkel.
Right, but understand that hospitals have HEPA filtration systems that are excellent. And in fact, the ward in which pregnant women are admitted is totally different than the ward in which patients are being taken care of for COVID-19. That would be emergency room wards and internal medicine wards and possibly ICU.
Thank you, Tanya, for that. And she also adds in her note, Dr. Gorfinkel, a thank you to the healthcare workers and the frontline workers, which are happy to pass along to you and your colleagues. A question from Christina, who, Dr. Gorfinkel, I'm not sure if you can see this, but I will pull these pictures up for our viewers. It's about masks and gloves, but not so much the usage of those. It's about how people are just tossing them. She sent some pictures. I think we can get to those, but just gloves on the ground. And in this case, it was on a grocery parking lot ground. And I was out. I noticed. There they come. For a jog the other day, there was a mask I ran around, and there was a glove or two just on the path and on the road. So we're seeing this maybe increasingly. Is there a way we should be disposing of these, and is there any risk from these discarded masks and gloves?
It's interesting. I saw one just yesterday when I was taking my walk, wondering, what the heck? Is there a proper way of disposing it? Well, there is no recommendation currently to incinerate these, but I would suggest just placing them in the usual trash would make the most sense and not leaving them on the street.
Yes, exactly. Litter of any kind, but it's kind of a surprising thing to see in increasing amounts, apparently. Okay, let's go to a question.
Absolutely.
Yes. Don Kettle wrote, and this is a great question because I think that we haven't exactly walked through this process, but Don was wondering how patients with COVID-19 are treated. Is it a matter of using the treatment methods for known coronaviruses or something entirely new? What do we know about exactly when someone presents either with mild or before they get to hospital? I mean, how do the doctors treat them?
It's an interesting question. It's basically the same as any other thing. We do not have any successful treatments or therapies that are known. There's theories, and there are now clinical trials happening to try to understand if certain antivirals may be of benefit, even if chloroquine will be of benefit. That's not a for sure. So the way these patients are approached, or the way all patients are approached, which is what we call the ABCDs, the airway, the breathing, the circulation, just the very basics of care.
All of that. Very, very interesting. Can I just ask, You mentioned that anti-malaria drug, which they are looking at, chloroquine, and the questions about that. If you take it wrongly, there's been a case of a man who actually died from taking it wrongly. But there's also a treatment that they're testing in New York that I'd love your take on, and that's when they use blood plasma from somebody who's recovered from coronavirus, and then they give it to someone who is ill with coronavirus. They're looking to see if there's some sort of antibody, some sort of immunity that could provide. Might that be something interesting that we should watch for the future?
Absolutely. And in fact, that concept of passive immunity has been used successfully in hepatitis, also a viral illness. So in theory, if we could take those antibodies that have been made by the body of somebody who successfully fought the virus, we could concentrate them and then give them to somebody else. So in theory, that's a very possible thing. However, for coronavirus, we still have yet to discover those antibodies. So that's why they're taking plasma as a whole, because we have yet to isolate the specific antibody against COVID. But it's more than a theory. I mean, this has been done, but can we do it for COVID, and can we do it in a timely way? For this, we keep our fingers crossed and hope for the best.
And watch New York with those clinical trials underway. Dr. Gorfinkel, we're hearing from Netzi, and she's the mom of 2 small kids. She's worried about her husband's health. He's an Uber driver, and he's still out there. He's now doing a lot of Uber Eats, actually, but he has blood pressure issues. He takes medication. Is he in the at-risk category?
Understand that the virus is transmitted through droplets. And that means being within 2 meters or 6 feet of someone who laughs, coughs, sneezes. So it does take that kind of proximity. I think a lot of drivers are well aware that, we're trying to maintain that physical distancing, so that makes a big difference. As far as living on the surfaces, carrying the food with which he's bringing to, that is not going to be that's not a great way of transmitting the virus. In theory, if somebody who'd prepared the food had coughed on the packaging and then he touched it and touched his face, his nose, his mouth, that could transmit it. So we are asking individuals, keep your hands away from your face, wash your hands frequently, the 20-second rule with either 60% hand sanitizer, alcohol, or with soap and water, of course.
We have really learned about the importance of hand washing, and we continue to stress that message and good hand hygiene. It is absolutely critical at this time. Lori, you mentioned food, and Lori has a question similar to that, well, about food anyway. She writes that she is self-isolating because she's not been feeling so well and is wondering how safe it is to prep meals and to cook and do things like that. And she would appreciate any guidance you could offer on that point.
Wash your hands before you cook. You can make meals. Food transmission is not a thing with the COVID-19. It's not been found to make any difference. But things that we can do that make a big difference to our body's immune system to fight off infection matter, and they matter a lot. So I want to come back down to the very basics, the 4 pillars of maintaining good health. And that includes getting adequate sleep, so 7 to 9 hours a night. This makes a huge difference to the body's immune system to be able to fight infection. Eating a healthy diet, a Mediterranean diet has been shown to increase longevity, so that's actually a great thing as well. Making sure we don't smoke, that's a huge thing. Ultimately, COVID-19 is a lung disease, so we want to make sure that that's a thing. And then the exercise piece. And it's actually been studied at what is the minimal amount of exercise we need, and it appears to be 30 minutes a day of walking for at least 5 days a week. And there's not just immune benefits, there's cancer reduction benefits. In fact, it reduces 30 known chronic conditions. So I just want to take a step a little bit away and see the forest through the trees here.
And we do know all the experts tell us we can still go outside for those walks or that jog or that bike ride, but it's really important. Again, we keep stressing the aspect of social, physical distancing if you're outside for that break once a day. To that point, though, you mentioned the smoking. Kathy wrote in, Dr. Gorfinkel, to say she was out on her walk yesterday. There she was, trying to keep up her good health, keeping her distance, and a man was walking toward her, she writes, smoking a cigar. As they passed each other, he was blowing out the smoke into the air. She's concerned, is it possible to get the virus from that kind of exhalation?
Any kind of exhalation that carries small droplets, whether it's in the form of a cigarette smoke exhalation or a cigar smoke, I mean, let's face it, the chance of that one encounter resulting in a COVID-19 illness is extremely small. But that said, could it, in fact, in theory, promote it? Absolutely, it could. So personally, it's probably a good idea to kind of cross the street when you see people coming. It's sad that people are still smoking, but that's a fact of life, and a lot of people will cope with the stress by smoking. But it's important to emphasize, smoking is very inflammatory to the lungs. In fact, there's a thing called the sidewalk. It's the mucociliary tract that carries bad mucus from the lungs out, and that is damaged by smoking. So basically, we want that mucociliary tract to be functioning well so that it does carry viruses and bacteria out of the lungs.
Roger wrote in to wonder about, this is something we've heard from a number of viewers over the past days, in fact weeks, but I think we haven't touched on it in a couple of days, so let's just reiterate. Roger wants to know whether he can take Advil or ibuprofen, because that has been a concern. Maybe we should stay away from that.
Currently, there is not the evidence to support that drugs like Advil, called the nonsteroidal anti-inflammatories, are in fact damaging. So there was this letter that was sent to the Lancet on March the 11th and published, suggesting that it may be a problem in COVID patients. However, there is no evidence base at this point to suggest that those drugs need to be avoided. As it turns out, that those kind of drugs in people over 65 may be problematic for other reasons, especially if they're diabetic or have high blood pressure or kidney disease. But basically, specifically for COVID-19, there's not that evidence base.
All right.
It's something we are watching carefully.
Thank you, Roger, for that question. Sarah and Paul have similar questions, so I will group them together, Dr. Gorfinkel. Sarah was writing, she's been isolated for 14 days. Her friends and family have done the same thing. Does that mean they can now get together? And similarly, Paul is wanting to know what duration of time of the virus until one is no longer a carrier, so until one is healthy again, and then could conceivably, as Sarah is wondering, could then get together. We talk about that 14 days. Where do they go from there?
You know, like any guideline, 14 days is just an approximation. It is not a religious edict. So we have to use common sense. If somebody is still symptomatic, yes, they are still shedding virus and they should be avoided. The purpose of that 2 weeks was more just like, okay, we want to make sure that people are well over the virus. Typically, viral infections last 7 to 10 days, so 14 days was thought to be a reasonable number. You know, for the people that you're describing, I really couldn't say it's too specific, but that said, that should give you an idea of where we're coming from. We want to make sure that person is asymptomatic before they have contact with anybody. And even that's not perfect, because now we're estimating that about 30% of individuals who are infected with COVID-19 may in fact be asymptomatic. So what do we do with this? It's very tricky.
Well, we're continuing to learn about this illness, of course, and hence that repeated message: social distancing, physical distancing, staying that 2 meters apart, even at the end of a period of self-isolation. Also, here's a question we haven't had, Dr. Gorfinkel, from Helga. Thank you very much. Wondering if it's safe to wash her laundry in a large apartment building. There are more than 150 people living there and using the same washers and dryers.
There is no evidence out there to suggest that the COVID-19 is transmitted through washing machines. So I would say wash away. And if anything, you know, what we know about cleaning, just while we're on the topic, is that a good homemade kind of formula is 1 part bleach with 9 parts of water. And that is actually known to kill the virus.
That is good advice. And I would think if you go, as I'm trying to think about apartment buildings where I've lived, you know, sometimes there are those big communal tables where people put the laundry on as they're getting them sorted, et cetera. You might want to make sure those surfaces are all cleaned and disinfected, I would think, as well.
That's reasonable.
All right. Wrapping up. One of the things that struck me, Dr. Gorfinkel, was what we heard yesterday from Newfoundland's health minister. His name is John Hagee, and he said, we're hoping for the best, we're planning for the worst. But then he went on to say that he doesn't expect things to be back to normal by the May 24th weekend. He said possibly by June, but that remains to be seen. So look ahead for us, if you would, and tell us what you think are sort of the keys as we look to these days and weeks ahead.
I think the minister has the right attitude, which is we have to keep an open mind about how things are going. This is new territory. It's not like we're soothsayers and know the future. We don't. And I think part of the success, the Canadian success story, will be that we, in fact, did keep an open mind. We were careful about what we did. We were thoughtful about what we did in advance. So while one can't know the future, we are playing it safe. We're trying to keep our numbers as low as possible. That doesn't mean zero. That doesn't mean a curve which is not going up. We know that we're on the uprise now in our numbers, but in making every effort to keep that as low as possible so as not to overwhelm our very limited health resources.
And you have 3 T's as a parting message. I want to make sure we get to those quickly.
Much appreciated, Heather. And the 3 T's are, well, the time has brought us something very special, and that's the ability to make the most of testing. So testing is actually rapidly evolving. So we are hoping for faster tests, for more efficient tests, tests that can give us answers in a faster time, and also tests that are way cheaper. So that's T number 1. T number 1 is test. T number 2, tracking. Better tracking systems. Everybody who has been exposed to somebody known to have tested positive needs to know that so that they themselves can go into strict quarantine. You know, so that's tracking. Other tracking systems that would be beneficial are hospitals willing to share supplies that are needed.
Yes.
You know, so that's a second type of tracking. The third T is training. Let us use the time that the lockdown provides us to train more healthcare professionals to fill in the gaps when those healthcare professionals are unable to do their duties.
Okay. I have another T, although it's more of a th. Thank you. Thank you, Dr. Gorfinkel, for all of your answers.
It is an honor and a privilege.
Lovely to have you with us this morning, and thanks to everyone who wrote in.